We're here at Be Beautiful today with Dr. Giovanni, who is doing microneedling with PRP, platelet-rich plasma. We call it our plasma facial. It's more commonly known as the vampire facial. We started off with microneedling the face. We use the derma pen. The idea is to turn the skin of the face into a sponge with thousands of microscopic holes to absorb the platelet-rich plasma. The microneedling causes microtrauma underneath the skin, and it's meant to be a collagen induction therapy. By creating microtrauma, you put the skin into repair mode, and it repairs itself by making new collagen. So microneedling by itself is a collagen induction therapy. Some people will do microneedling without plasma. Adding the platelet-rich plasma introduces growth factors into the skin to augment the response, to augment the repair, if you will, and to increase the amount of collagen that's produced. Typically speaking, if you're going to microneedle, it makes sense to use plasma in addition. The benefit of microneedling with PRP primarily is collagen induction. So it acts as a way to be a natural filler for the whole face. Some people will inject hyaluronic acid fillers to spot treat different areas on the face where they have volume loss or wrinkles. Doing microneedling with PRP is a way to fill the entire face. Many people prefer microneedling with PRP over traditional hyaluronic acid fillers for a number of reasons. One, it's typically less expensive than trying to achieve the same outcome with fillers. Two, it's a completely natural process where you're just exploiting your body's natural repair mechanisms to create new collagen in the face. Additionally, there's no risk that the outcome will look unnatural or create one part of your face that's disproportional to the rest. Because your body is simply creating new collagen on its own architecture, there's never any possibility that the outcome will look unnatural or overdone. In addition, PRP helps make your skin more healthy. Putting filler with hyaluronic acid doesn't do anything to make your skin more healthy. But by introducing the growth factors under the skin, in addition to making more collagen, it will normalize the function of the cells to produce healthier skin. Today, Dr. Giovanni is using a concentrated vitamin C serum as her glide. Vitamin C is an essential treatment for people with irregular pigmentation or areas of hyperpigmentation, such as people who have melasma. By using a concentrated vitamin C serum for the glide, she's able to introduce vitamin C in the areas of hyperpigmentation at a deeper level than just simply applying it topically. So what she's doing now is applying the PRP, the platelet-rich plasma. At the beginning of the procedure, we draw the patient's blood. It goes into a centrifuge for 14 minutes. And then we drop the platelet-rich plasma. So after preparing the skin with the microneedling, it turns the skin into a sponge, which very easily absorbs the PRP. Some people differentiate between clear platelet-rich plasma and red platelet-rich plasma. It's important that your PRP be red. When you centrifuge blood, the products of blood are separated out based on their weight. The weight of the platelets is similar to the weight of the immature red blood cells. So if you're using clear PRP, you're missing out the immature red blood cells, which means you're missing out some platelets. The idea is to have as high a concentration of platelets as possible. The higher the concentration, the more effective the treatment. So that's why you'll see the PRP that's applied is red. People often ask us why there's such a broad range of cost associated with having a plasma facial done. Certainly, if you compare different practices in different locations, you're going to see a broad range of prices, ranging probably from as little as $100 to over $1,000. Most of the time, it's related to the cost to the practice to perform the procedure. In order to get a high concentration of platelets, adequate enough to make a difference, you typically need very expensive equipment, including a centrifuge. Generally, you get what you pay for. So if you're not paying much, you're not getting much. Wherever you go for a consultation, be sure to ask the practitioners what centrifuge they're using and what concentration of platelets that will yield. Any good practice should be able to tell you that.